Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuy.com. This is 25 practice NCLEX questions. Without the way, let's get started.
While caring for a moderately obese prima gravida client in active labor at term, the nurse should monitor the client for signs of which the following: 1. Hypotonic reflexes. 2. Increased uterine resting tone. 3. Soft tissue dystocia. 4. Increased fear and anxiety. The correct answer is 3. The obese pregnant client is more susceptible to soft tissue dystocia, which can impede the progress of labor. Symptoms of soft tissue dystocia would include an arrest of labor, prolonged labor, or an arrested descent of the fetus. Hypotonic reflexes are associated with magnesium sulfate therapy, and increased uterine resting tone is associated with hypertonic labor patterns in early labor, not with obesity and pregnancy. Increased fear and anxiety are also not associated with obesity. However, they may be associated with a prima gravida client who does not know what to expect during labor. Assessment of a prima gravida client in active labor who has had no analgesia or anesthesia reveals complete cervical effacement, dilation of 8 centimeters, and the fetus at 0 station. The nurse should expect a client to exhibit which of the following behaviors during this phase of labor? 1. Excitement. 2. Loss of control. 3. Numbness of the legs. 4. Feelings of relief. The correct answer is 2. Assessment findings indicate that the client is in the transition phase of labor. During this phase, it is not unusual for clients to exhibit a loss of control or irritability. Leg tremors, nausea, vomiting, and urge to bear down also are common. Excitement is associated with the latent phase of labor. Numbness of the legs may occur when epidural anesthesia has been given. However, it is rare when no anesthesia is given. Feelings of relief generally occur during the second stage, when the client begins bearing down efforts. Assessment reveals that the fetus of a multigravida client is at +1 station and 8 centimeters dilated. Based on these data, the nurse should first: 1. Ask the anesthesiologist to increase epidural infusion rate. 2. Assist the client to push if she feels the need to do so. 3. Encourage the client to breathe through the urge to push. 4. Support family members in providing comfort measures. The correct answer is 3. The urge to push is often present when the fetus reaches plus stations. This client does not have a cervix that is completely dilated, and pushing in this situation may tear the cervix. Encouraging the client to breathe through the urge to push is the most appropriate strategy and allows the cervix to dilate before pushing. Increasing the level of the epidural is inappropriate, as nursing would like to have the client be able to push when she is fully dilated. This may occur quickly with a multigravida client. Comfort measures are important for the client at this time, but are not the highest priority for the nurse. The primary health care provider prescribes intermittent fetal heart rate monitoring for a 20-year-old obese prima gravida client at 40 weeks gestation in the first stage of labor. The nurse should monitor the client's fetal heart rate pattern at which of the following intervals? 1. Every 15 minutes during the latent phase. 2. Every 30 minutes during the active phase. 3. Every 60 minutes during the initial phase. 4. Every 2 hours during the transition phase. The correct answer is 2. Labor is categorized into 3 phases: latent, active, and transition. During the active stage of labor, intermittent fetal monitoring is performed every 30 minutes to detect changes in fetal heart rate, such as bradycardia, tachycardia, or decelerations. If complications develop, more frequent or continuous electronic fetal monitoring may be needed. During the latent phase, intermittent monitoring is usually performed every 2 hours because contractions during this time are usually less frequent. During the transition phase, intermittent monitoring is performed every 5 to 15 minutes because the client is getting closer to birth the baby. There is no initial phase of labor. The nurse is managing care of a prima gravida at full term who is in active labor. What should be included in developing the plan of care for this client? 1. Oxygen saturation monitoring every half hour. 2. Supine positioning on back, if it is comfortable. 3. Anesthesia/pain level assessment every 30 minutes. 4. Vaginal bleeding. Rupture of membrane assessment every shift. The correct answer is 3. The nurse should monitor anesthesia/pain levels every 30 minutes during active labor to ascertain that this client is comfortable during the labor process, and particularly during active labor when pain often accelerates for the client. When in active labor, oxygen saturation is not monitored unless there is a specific need, such as heart disease. The client should not be on her back, but wedged to the right or left side to take the pressure off the vena cava. When lying on the back, the fetus compresses the major blood vessels. Vaginal bleeding in active labor should be monitored every 30 minutes to 1 hour. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. Which of the following behaviors exhibited by the parents of an infant with pyloric stenosis should the nurse correctly interpret as a positive indication of parental coping? 1. Telling the nurse that they have to get away for a while. 2. Discussing the infant's care realistically. 3. Repeatedly asking if their child is normal. 4. Exhibiting fear that they will disturb the infant. The correct answer is 2. The parent's ability to verbalize the infant's care realistically indicates that they are working through their fears and concerns. This behavior demonstrates an understanding of the infant's condition and needs. Without further data, the fact that the parents have to get away could be interpreted as ineffective coping, possibly suggesting that they are unable to handle the situation. Continuing to ask about the child's general condition even after answers have been given does not suggest effective coping. The parents are demonstrating that they are unsure themselves as parents or are hoping for positive information. Exhibiting fear that they will disturb the infant does not suggest effective coping. This behavior indicates that they are uncertain or lack knowledge about infants. Immediately after the first oral feeding after corrective surgery for pyloric stenosis, a 4-week-old infant is fussy and restless. Which of the following actions would be most appropriate at this time? 1. Encourage the parents to hold the infant. 2. Hang a mobile over the infant's crib. 3. Give the infant more to eat. 4. Give the infant a pacifier to suck on. The correct answer is 4. Giving the infant a pacifier would help meet non-nutritive sucking needs and ensure oral gratification. Additionally, sucking aids in calming the infant. Holding the infant to decrease fussiness and restlessness is more effective in an older infant. Also, the reason for the infant's fussiness needs to be explored. Hanging a mobile over the crib frequently does not decrease fussiness. After surgery to correct pyloric stenosis, feeding the infant more formula would lead to vomiting, putting additional stress on the operative site. After surgery to correct pyloric stenosis, the nurse instructs the parents about the postoperative feeding schedule for their infant. The parents exhibit understanding of these instructions when they state that they can start feeding the child within which of the following time frames? 1. 6 hours. 2. 8 hours. 3. 10 hours. 4. 12 hours. The correct answer is 1. Clear liquids containing glucose and electrolytes are usually prescribed 4 to 6 hours after surgery. If vomiting does not occur, formula or breast milk then can be gradually substituted for clear liquids until the infant is taking normal feedings. After undergoing surgical correction of pyloric stenosis, an infant is returned to the room in stable condition. While standing by the crib, the mother says, "Perhaps if I had brought my baby to the hospital sooner, the surgery could have been avoided." Which of the following should be the nurse's best response? 1. Surgery is the most effective treatment for pyloric stenosis. 2. Try not to worry. Your baby will be fine. 3. Do you feel that this problem indicates that you are not a good mother? 4. Do you think that earlier hospitalization could have avoided surgery? The correct answer is 4. Restating or rephrasing a mother's response provides the opportunity for clarification and validation. It also helps to focus on what the mother is saying and address her concerns and feelings. Although surgery is the most effective treatment for pyloric stenosis, Stating this ignores the mother's feelings and does not give her an opportunity to express them. Telling the mother not to worry also ignores the mother's feelings. Additionally, this type of statement gives a mother premature reassurance, which may turn out to be false. Asking the mother if she thinks the problem indicates that she is not a good mother implies such an idea. It does not allow her to express her concerns and feelings, and therefore is not a therapeutic response. A newborn admitted with pyloric stenosis is lethargic and has poor skin turgor. The primary care provider has prescribed IV fluids of dextrose water with sodium and potassium. The baby's admission potassium level is 3.4 milliequivalents per liter. The nurse should 1. Notify the primary care provider. 2. Administer the prescribed fluids. 3. Verify that the infant has urinated. 4. Have the potassium level redrawn. The correct answer is 3. Normal serum potassium levels are 3.5 to 4.5 milliequivalents per liter. Elevated potassium levels can cause life-threatening cardiac arrhythmias. The nurse must verify that the client has the ability to clear potassium through urination before administering the drug. Infants with pyloric stenosis frequently have low potassium levels due to vomiting. A level of 3.4 milliequivalents per liter is not unexpected and should be corrected with the prescribed fluids. The lab value does not need to be redrawn, as the findings are consistent with the infant's condition. After teaching the mother of an infant with pyloric stenosis about the disease, which of the following is stated by the mother as a cause, indicates effective teaching? 1. An enlarged muscle below the stomach sphincter. 2. A telescoping of the large bowel into the smaller bowel. 3. The result of giving the baby more formula than is necessary. 4. The result of my baby taking the formula too quickly. The correct answer is 1. Pyloric stenosis involves hypertrophy of the pylorus muscle distal to the stomach and obstruction of the gastric outlet, resulting in vomiting, metabolic acidosis, and dehydration. Telescoping of the bowel is called intussusception. Overfeeding, feeding too quickly, or underfeeding is not associated with pyloric stenosis. When an infant with pyloric stenosis is admitted to the hospital, which of the following should the nurse do first? 1. Weigh the infant. 2. Begin an intravenous infusion. 3. Switch the infant to an oral electrolyte solution. 4. Orient the mother to the hospital unit. The correct answer is 1. Unless the infant is in hypovolemic shock. Obtaining a baseline weight is an important first action because the weight is used to calculate the child's fluid and electrolyte needs. The intravenous fluid rate and the amounts of electrolytes to be added to the fluid are based on the infant's weight. The weight also helps determine the infant's degree of dehydration. The intravenous infusion is initiated once the weight has been obtained. The child with pyloric stenosis typically experiences vomiting and is at risk for fluid volume deficit and metabolic acidosis. As a result, oral food and fluids are withheld, and the infant is allowed nothing by mouth. Fluid replacement is given intravenously. Orientation can wait until treatment is underway. A 4-week-old infant admitted with a diagnosis of hypertrophic pyloric stenosis presents with a history of vomiting. The nurse should anticipate that the infant's vomitus would contain gastric contents, and which of the following? 1. Bile and streaks of blood. 2. Mucus and bile. 3. Mucus and streaks of blood. 4. Stool and bile. The correct answer is 3. The vomitus of an infant with hypertrophic pyloric stenosis contains gastric contents, mucus, and streaks of blood. The vomitus does not contain bile or stool because the pyloric constriction is proximal to the ampulla of Fata. When developing a plan of care for a neonate who was diagnosed with an anorectal malformation and who subsequently underwent surgery, which of the following would be most helpful in facilitating parent-infant bonding? 1. Explaining to the parents that they can visit at any time. 2. Encouraging the parents to hold their infant. 3. Asking the parents to help monitor the infant's intake and output. 4. Helping the parents plan for their infant's discharge. The correct answer is 2. Encouraging the parents to hold their neonate promotes parent-infant attachment. Parent-infant bonding is based on a relationship that begins when the parent first touches the infant. Both the parents and the infant have predictable steps that they go through in this process. Explaining that the parents can visit at any time promotes bonding only if they do visit with, talk to, and hold the newborn. Asking the parents to help monitor intake and output at this time may be too anxiety-producing, thus interfering with bonding. Helping the parents plan for the infant's discharge, involve them in the newborn's care, and is important. However, it is not the first step in the development of bonding. The father of a neonate scheduled for gastrointestinal surgery asks the nurse how newborns respond to painful stimuli. Which of the following should be the nurse's best response? 1. Newborns cry and cannot be distracted to stop crying. 2. When faced with the pain, newborns try to roll away from it. 3. Newborns typically move their whole body in response to pain. 4. Pain causes a newborn to withdraw the affected part. The correct answer is 3. The neonate responds to pain with total body movement and brief, loud crying that ceases with distraction. After the age of 6 months, an infant reacts to pain with intense physical resistance and tries to escape by rolling away. A toddler reacts to pain by withdrawing the affected part. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. When the infant returns to the unit after imperforate anus repair, the nurse should place the infant in which of the following positions? 1. On the abdomen, with legs pulled up on the body. 2. On the back, with legs extended straight out. 3. Lying on the side with the hips elevated. 4. Lying on the back in a position of comfort. The correct answer is 3. After surgical repair for an imperforate anus, the infant should be positioned either supine with the legs suspended at a 90-degree angle or on either side with the hips elevated to prevent pressure on the perineum. A neonate who is placed on the abdomen pulls the legs up under the body, which puts tension on the perineum, as does positioning the neonate on the back with the legs extended straight out. After teaching the mother of a neonate who has successfully undergone surgery to repair a low anorectal anomaly, the mother indicates that she understands her child's prognosis when she states which of the following? 1. My child will need to wear protective pads until puberty. 2. My child will need extra fluids to prevent constipation. 3. My child will probably always need a high-fiber diet. 4. My child has a good chance of being potty trained. The correct answer is 4. Children who undergo surgical correction for low anorectal anomalies, as infants usually are continent. Fecal continence can be expected after successful correction of anal membrane atresia. Therefore, this child probably has a good chance of being potty trained and will not need to wear protective pads. Extra fluids and a high-fiber diet are not required to prevent constipation. Children with high anorectal anomalies may or may not achieve continence. Which of the following should the nurse assess in a newborn diagnosed with an anorectal malformation? Select all that apply. 1. Abdominal distension. 2. Loose stools. 3. Vomiting. 4. Meconium in the urine. 5. Meconium stools. The correct answers are 1, 3, and 4. Anorectal malformations present with lack of stool or evidence of meconium in the urine through a fistula. Meconium is not found in the stool. Because stool does not pass, abdominal distension and vomiting occur. After completing diagnostic testing, the surgeon has scheduled a newborn with a diagnosis of an imperforate anus for surgery the next day. The infant's parents are Catholic and do not want the surgery to take place unless the infant has first been baptized. The nurse asks the parents, 1. Are you worried your baby might die? 2. Do you want me to help arrange the baptism? 3. Do you want to speak with a social worker? 4. Would you prefer to wait for the surgery? The correct answer is 2. The nurse should honor the parent's belief system and help arrange to have the infant baptized. This may be done through the hospital's chaplaincy department or by the family's clergy. The parents may indeed be worried that the infant may die during surgery. Having the infant baptized would help address the family's spiritual needs. At this time, there is an immediate need for chaplaincy, not social service. While surgery may be postponed briefly, the infant cannot begin feeding until an outlet for stool has been established. Therefore, it is not advisable to postpone the surgery for a prolonged period of time. A newborn who had a surgical repair of a tracheoesophageal fistula is started on oral feedings. Which of the following should the nurse include in the teaching plan for the mother about oral feedings? 1. They are better tolerated when larger, but less frequent feedings are offered. 2. They should be offered on a feeding schedule to help the infant accept the feedings more readily. 3. They are best accepted by the infant when offered by the same nurse or by the infant's mother. 4. They are best planned in conjunction with observations of the infant's behavior. The correct answer is 4. When initiating oral feedings after surgical repair of a TEF, it is best to follow a plan of care in conjunction with observation of the infant's needs and behavior. When the infant's needs and behavior are overlooked, plans are likely to be unsatisfactory and are more likely to meet the nurse's needs rather than the infant's needs. After a surgical procedure, infants initially tolerate small amounts of fluids offered more frequently better than larger amounts offered less often. Smaller amounts cause less bloating as the infant becomes used to feeding again. Although infants accept feedings more readily from their mother or from someone who feeds the infant repeatedly, the priority is to meet the infant's nutritional needs based on the infant's behavior. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. After surgery to repair a tracheoesophageal fistula, an infant receives gastrostomy tube feedings. After feeding the infant by this method, the nurse cradles and rocks the infant for about 15 minutes, primarily to help accomplish which of the following? 1. Promote intestinal peristalsis. 2. Prevent regurgitation of formula. 3. Relieve pressure on the surgical site. 4. Associate eating with a pleasurable experience. The correct answer is 4. The nurse can help meet the psychological needs of an infant being fed through a gastrostomy tube by rocking the infant after feeding. The infant soon learns to associate eating with a pleasurable experience and learns to trust the caregiver. Rocking the infant will not promote peristalsis or prevent regurgitation. Holding the baby will not relieve pressure on the surgical site. However, holding the child right after feeding promotes comfort and pleasure. The nurse is administering gastrostomy feedings to an infant after surgery to correct a tracheoesophageal fistula. To prevent air from entering the stomach, once the syringe barrel is attached to the gastrostomy tube, the nurse should 1. Unclamp the tube after pouring the complete amount of formula to be administered into the syringe barrel. 2. Pour all the formula to be administered into the syringe barrel after opening the clamp. 3. Maintain a continuous flow of formula down the side of the syringe barrel. Once the clamp is opened, allow a small amount of formula to enter the stomach before pouring more formula into the syringe barrel. The correct answer is 1. The best way to prevent air from entering the stomach when feeding an infant through a gastrostomy tube is to open the clamp after all the formula has been placed in the syringe barrel. Doing so prevents air from mixing with the formula and thus being introduced into the stomach. Pouring all the formula into the barrel after opening the clamp, maintaining a continuous flow of formula down the side of the barrel after unclamping the tube, and allowing a small amount of formula to enter the stomach before adding more formula to the barrel permit air to enter the stomach. Which of the following would indicate that an infant with a tracheoesophageal fistula needs suctioning? 1. Brassy cough. 2. Substernal retractions. 3. Decreased activity level. 4. Increased respiratory rate. The correct answer is 2. With a TF, overflow of secretions into the larynx leads to laryngospasm. This obstruction to inspiration stimulates the strong contraction of accessory muscles of the thorax to assist the diaphragm in breathing. This produces substernal retractions. The laryngospasm that occurs with a TF resolves quickly when secretions are removed from the oropharynx area. A brassy cough is related to a relatively constant laryngeal narrowing, usually caused by edema. It is not an indication of the need to suction. A decreased activity level and an increased respiratory rate in an infant with a TF are usually the result of hypoxia, a relatively long-term and constant phenomenon in infants with a TF. After teaching the parents of a neonate diagnosed with a tracheoesophageal fistula about this anomaly, the nurse determines that the teaching was successful when the father describes a condition as which of the following? 1. The muscle below the stomach is too tight, causing the baby to vomit forcefully. 2. There's a blind upper pouch and an opening from the esophagus into the airway. 3. The lower bowel is lacking certain nerves to allow normal function. 4. A part of the bowel is on the outside without anything covering it. The correct answer is 2. Although a TEF can include several different structural anomalies, the most common type involves a blind upper pouch and a fistula from the esophagus into the trachea. Other types include a blind pouch at the end of the esophagus with no connection to the trachea, and a normal trachea and esophagus with an opening that connects them. A tightened muscle below the stomach and projectile vomiting of normal amounts of formula are characteristic of pyloric stenosis. A ganglionic megacolon is a lack of autonomic parasympathetic ganglion cells in a portion of the lower intestine. Gastroschisis occurs when the bowel herniates through a defect in the abdominal wall and no membrane covers the exposed bowel. The parents of a child with a tracheoesophageal fistula express feelings of guilt about their baby's anomaly. Which of the following approaches by the nurse would best support the parents? 1. Helping the parents accept their feelings as a normal reaction. 2. Explaining that the parents did nothing to cause the newborn's defect. 3. Encouraging the parents to concentrate on planning their baby's care. 4. Urging the parents to visit their newborn as often as possible. The correct answer is 1. The parents of children born with defects often have feelings of guilt and ask what they might have done to cause a condition or how they might have avoided it. It is important to allow parents to express their feelings and to accept these feelings as normal reactions. Explaining that the parents are not at fault would not be appropriate until they have dealt with their feelings of guilt. Encouraging long-term planning generally is of little benefit to parents who are emotionally distraught. Additionally, the parents may interpret this as ignoring their feelings and confirming that they played a role in causing their child's anomaly. Urging the parents to visit their infant as often as possible would generally be of little help and could appear to the parents as though they are being talked out of their feelings. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.